The federal government, through the National Orientation Agency in partnership with the Federal Ministry of Health, other partners have commissioned NOMA Treatment Center in Abuja on Wednesday. Stakeholders say the commissioning is in a bid to find lasting solution to issues affecting children caused by NOMA diseases, which was done to commemorate the National NOMA Day. Our correspondent Mavis Ako now reports.
NOMA is a deadly disease that destroys the mouth and face of children between the ages of 2 and 6. It has been identified as a common disease in the Sahel part of Nigeria, but with funds from private donations and individuals in both Germany and Austria, a NOMA treatment center was established. The National Orientation Agency, in partnership with the Federal Ministry of Health, other partners, commissioned the NOMA Center on Wednesday in Abuja. The German ambassador to Nigeria, while explaining the significance of the private donations, expressed that it is important to foster the relationship between both countries and ensure tackling of the deadly disease.
The establishment of the NOMA Center Abuja was funded entirely by private donations of individuals in Germany and Austria. Like I said, all of this is not supported by my government, but by private donations. To me, this is significant for 3 reasons. 1, it shows the strength of private initiative. If citizens consider something important, they are ready to contribute both in terms of their time as well as financially. This carries important lessons in times of constrained budgets, both in Nigeria and in Germany. Citizens and the private sector have an important role to play in the development of our countries and in tackling the multiple changes that we are all faced with in our society. So one must not always look towards the state to fix certain problems. Secondly, it shows the close relations between our 2 societies. The donations were made possible from individuals that consider the fate of individuals in Nigeria to be as valuable as their own.
The coordinating Minister of Health and Social Welfare, in her speech, stressed the need to fight against NOMA in Nigeria.
In tandem with global drives such as SDGs, Sustainable Development Goals, that's what it is, NOMA should not exist as a disease, and its prevalence is an indicator for urgent action to be taken in the quest for accelerated implementation of the Sustainable Development Goal 3 and ensuring the realization of universal health coverage. The federal government in this dispensation is not resting and will not rest until this disease is eradicated from the country.
Speaking further, the Chief Medical Director, National Hospital, expressed that the center is a beacon of hope to affected children and gave his assurance to ensuring the center upholds the highest standard of care and treatment.
The establishment of the NOMA Center here at the National Hospital serves as a beacon of hope to every child battling this disease and their families as well. This partnership fortifies our resolve to actively combat this condition and affirms our commitment to provide the best care possible to our patients.
Critical stakeholders also reiterated their commitment to assisting Nigerians control NOMA disease.
To truly eradicate NOMA, we need to intensify our efforts in primary health care access, including dental care, vaccination programs, and malnutrition prevention.
To actually eradicate NOMA, the NDA, Nigerian Dental Association, advocates for implementation of the National Oral Health Policy. And this policy will entail even taking oral health and integrating oral health to the primary health care centers.
The representative of National Orientation Agency further sensitized Nigerians to ensure they get a good hygiene at all times.
NOA, as you know, is the unique organization that disseminates, enlightens, and creates awareness, sensitizes and mobilizes citizens of Nigeria concerning programs and activities of government and other issues that affect them. And this NOMA disease is a major, major one.
The Nigerian government, therefore, has expressed commitments to eradicate the disease completely from the country by 2030. From the nation's capital, Mavis Ako, KAFTAN TV News.